Hello there, a very good morning, and from the beginning of the show, a very happy Sinhala and Tamil New Year. Of course, this Sinhala and Tamil New Year this year in Sri Lanka is unlike any other because we have been confined to our homes and been placed under certain restrictions. But that does not mean that any of our festivities as far as the home unit goes needs to be curtailed. And to discuss this subject and also the current situation here in Sri Lanka, we've got in our studios with us two eminent personalities. On my immediate right, we have Professor Indika Karunathilaka, the current president of the Sri Lanka Medical Association. A very good morning, Professor, and welcome to the show. Also, we've got on his right Dr. Ajanta Ajanta, former president of the Sri Lanka Medical Association. A very good morning to you too, Doctor, and welcome to the show. Professor, I'll first start with you. You are here in the capacity, of course, as the president of the Sri Lanka Medical Association, but beyond that, you are also a devout Sinhala Buddhist and a person who is celebrating the Sinhala and Tamil New Year. Professor, tell me, how do you plan on celebrating the Sinhala and Tamil New Year this time around?
Yes, so now actually, like you said, the Sinhala and Hindu New Year is a period of joy, happiness, and a period of new hope for all of us, all Sri Lankans. And this time period, the coronavirus, new COVID-19 epidemic, it has engulfed the world and overcast, and Sri Lanka also the situation is the same. But I think still, this is a time period for us as Sri Lankan to have new hopes and celebrate. New hope means to have new hopes of overcoming this threat of COVID-19 and to celebrate the courage of a nation who is courageously and successfully facing this epidemic that is affecting the whole world. So I think still the New Year time period should remain a period of happiness and hope and celebration for all of us as Sri Lankans.
Dr. Ajanta, we see people coming before us and saying that, we can't celebrate the New Year, but we really can. We can perform these traditions. But being confined at home, if one person really asks, how can I really celebrate this Sinhala and Tamil New Year? What would be your answer? How can I really celebrate?
It's a good question, Sean. I think it is very important for us to realize with the present context and the way that we are managing the situation with control of this infection, your celebration of the Sinhala and Tamil New Year has to be with your immediate family members at home. That's very important because God looks at whether you are using your brain, not using something else down the line. So it's very important for us to realize the fact that you have to celebrate with your immediate family members at home, and it is very important for us to realize that we have enough social media where you can contact your next kith and kin, your relatives through social media and give your blessings to them and vice versa, which should help. But this Sinhala and Tamil New Year, as far as I am a Hindu, so we celebrate the Tamil New Year for looking at the cultural beliefs and what has happened over with our ancestors. And it is more than a religious, it's a cultural event.
Okay.
That's why it has become a Sinhala and Tamil New Year and not a Buddhist and Hindu New Year. That's the important factor here. It's a Sinhala and Tamil New Year. It's not a Buddhist and Hindu New Year. So religion is out of the equation. The cultural belief is almost the same if you look at it. When we have anointed the oil, we have what is called Marathanir in Tamil, which we used to have a head bath. We go to the temple, have a puja, we make kiribath at home and basically have the blessings from the elders and celebrate at home. So very, very important for us to realize the fact that you celebrate at home and make sure that we pray for better well-being for the future.
Doctor, when it comes to, you spoke about some traditions. When it comes to the tradition of anointing of oil, and now we know that we have been advised to social distance, not to touch other people, especially even not to touch your own face. But when it comes to these sort of traditions that warrants for contact, how do we perform these traditions?
Now, if you look back, with the curfew being placed in Colombo and around Sri Lanka, When people, okay, in my house, I am the only person who goes out to work. Being a medical profession, I may have to go out to see patients. Purchase of items, which is mainly done by me on the way, or if there is any way that we could buy some items.
Okay.
But we use simple manuals where we prevent other people getting infected. So washing your hands, using a mask when you go out, making sure you wash your vegetables and all that in the garage and dry with soapy water and dry them and take them in. So simple manuals so that your infection stays at the doorstep, not going in. So people who are living inside the house do not have a problem on most occasions where they can be moving around. Unless you have someone with symptoms who needs to get isolated, then it becomes a problem in the house. If not, there is no problem in the house. You follow what I mean? Because you are inside the house. You are not. So when you go to a community level, when you go to a supermarket and when you want to buy items, that the contact is much more. Here there are 5 or 7 people in the house, maximum maybe 10 people. But if you today's context, if there are 10 people in the house, it is a large family.
Right.
If there are 4 people in the house, it's a nuclear family. So if you have a nuclear family, you don't have a major problem. Even with the large family who have been not going out, they are not infective.
Right.
So you make sure that the person who goes out and comes in appropriately decleanses himself to prevent other people getting infected. Very important.
Professor Indika, now since curfew was imposed, we saw that there were more arrests in Sri Lanka than the number of patients that were being reported, which means certain people are not taking this matter seriously. So with the coming of the new year, with the celebrations, it's quite obvious to assume that there will be certain people who will be more inclined to violate curfew and the social distancing regulations that have been imposed by the government. Professor, what is your message to these people who plan on placing cultural celebrations over controlling the current pandemic and the crisis situation that has hit our country?
Yes, I think the main message is, at the moment, the most important thing is prevention the spread of this disease. Because everything in the country depends on that. It's true that Sri Lanka has managed to control the spread of disease in a very encouraging way.
Right.
However, having said that, we cannot afford to have any chances.
Right.
At the moment, the country has managed to control it in the ideal way.
Right.
However, even the smallest mistakes or crowd gathering, it might lead to certain problems, lot of problems. So my message is that we have to keep to the basic principle of keeping the physical distancing. And having said that, I would say most of the Sri Lankans have been fantastic. And I would say that during this New Year period, we have to thank all of them for the sacrifices that they are making. Sacrificing the New Year visits or most of the rituals is actually something that we have to appreciate.
Right.
So generally we need to thank all the Sri Lankans for their support that is given to the government as well as the health officials and the other advisors. So my advice is stick to the basics, enjoy this New Year time period. You can enjoy with your family members, even within the constraints of physical distancing. You can still connect up with your friends and colleagues and near and dear, that's possible. So within that constraint, within that limitations, enjoy the life, enjoy the new year and celebrate. So that's very important.
Dr. Ajanta, speaking about a little bit about the current situation here in Sri Lanka, we know a few days back there were 6 COVID-19 confirmed cases that were found in Jail. Now, whenever patients keep popping up from different areas of the country, people in surrounding areas or in the city limits themselves tend to begin to get a bit worried. Is this really a matter that needs to worry these people? And if a person is worried, what should they really do?
There are 2 things to it. One important factor is that this is very infective. So the numbers who get infected are high if you don't have controls of social distancing.
Right.
Now, why we are seeing these clusters of patients, probably they have come into contact with someone who probably may have been COVID-19 positive. He may have been asymptomatic. You know, so this is one factor that we have an issue where we may be having people who may be asymptomatic and still carrying the virus. So the government, I think, has now started off to look at whether we need to screen the close contacts with, investigation, so that you get to know who are possible threat, who can be infected, number one. Number two, I don't think, people must realize the fact that the numbers are big getting infected, but the death rate is very small. When the numbers are big, the numbers who die may become worse if we are not careful. But as far as Sri Lanka is concerned, so far we have been very, 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 very good. So we have a good control because we have a very good public health system. We have a very good system where the public health midwives basically know every single house around which they carry, the village they cover.
And not even well-developed countries like the United States can even
do not
boast
have
of
it. They are no patch to us. We have the best public health system in the world, even that have been quoted by the WHO Director General. And we have to realize the fact that our immunization coverage is almost 99.5%, so that the midwives know every single household who is coming, who is going, who has come from Italy, who has gone to Germany. All those details they know. So they know the inside out of most of the houses. So they know if someone has come from outside, someone may have given the infection, that information goes around and they can always screen. So we have been lucky enough, I would call it like the criminal investigation department, like the CID. You have a group of midwives who are very, very good. So the public health midwife, the public health inspector, the medical officer of health, they form the line of preventive medicine for us.
Right.
And they are the pillars of this. And the people at the front line who are looking after the patients is one side of it. But preventing infection and having control on people moving around is very important. It's very difficult for the Triforces to go into every lane and make sure that people don't move into the other houses. So they are given talks by these midwives who tell them the importance of self-isolation, social distancing, all that is told. There's so much in the media. So I don't think people far away should get worried about it and be concerned about it, as far as you are very careful. You look after yourself in the home framework, don't go out unnecessarily, and make sure that you have methodologies of quarantining and self-isolation if needed to, but hand washing and social distancing
is a must. And as per current regulations, that
using the mask.
Imposed by the government. Yes, using the mask even if you do have a permit.
Yes, you need to use a mask. I think because there is a concern that the infection rate is high, mainly because the droplet is surviving more in the outside temperatures and the surfaces. So that the cross-infection chances are high. So if you to be on the safer side, wear a mask, use a pair of goggles, don't touch your nose, don't touch your mouth, don't touch your eyes.
Right.
Very important.
Professor Indika, I'm going to ask you the million-dollar question here. People are wondering, when can we return back to normalcy? Now, I know that there is no definite answer for this, but how far can the people expect that these measures will continue to last?
Yes, I think it's a very difficult question to answer. Probably there's no one in this world who can give a definite answer for that. But having said that, what I can say is, now this being a new virus, nobody really knows exactly everything about how this is going to behave, or even how it is behaving at this moment, how it actually infects, what happens within the body. All these things at the moment you have to depend on the current evidence and the data. But still, based on the evidence and the data that is emerging worldwide, there are certain patterns that you can identify. For example, one common pattern is the infection goes up, reaches a peak, and then goes down gradually. That's one thing. So that common pattern is observed in many countries, and very likely it should be observable in Sri Lanka as well. One thing that is very unique in Sri Lanka is Sri Lanka's curve has been very flat. In other countries, it has been thousands or maybe hundreds of thousands. But Sri Lanka's curve is very flat. One reason is the strict control measures that has been applied very early on. Initially, there was some uncontrolled imported cases or overseas returnees, but very soon the system has moved into mechanisms and start this control. So answer to this question, your question, when is going to end? Now again, it has to be only estimates.
Okay.
Predictions, and there are certain mathematical and statistical models that are emerging. The Sri Lanka Medical Association, also in collaboration with the Ministry of Health and World Health Organization, many other organizations, we have worked out the mathematical model. It's the credit goes to one of the public health experts in our council, Professor Manu Singh and Dr. Nishanta Pirana. They were the people who developed this mathematical model. And this mathematical model again takes different scenarios into consideration.
Okay.
Because everything depends on how our citizens behave.
Right.
If the current strict controls apply and we also comply with these strict controls, currently the number of cases that we are seeing is low.
Okay.
In that case, we have seen the peak and it should be going down. Maybe next 2 to 3 weeks time period, it should be going down.
Right.
But that is provided this good control that the government has been applying and Sri Lankans have been complying with. If it goes beyond, we call it say 5% risk of non-adherence, 10% risk of non-adherence and 25% of non-adherence.
Right.
Now we are at the ideal law, maybe 5% of non-adherence.
Right.
Some non-adherence is there,
Right.
that cannot be avoided. But if it goes more than that, then the number may be increasing and we haven't reached the peak yet in that case. Then it might go into maybe about 350 or so according to the statistical model and then come down towards May.
Right.
And if there is larger kind of much higher deviation from the adherence, say 25% of deviation, then we may be seeing about say towards end of April maybe 1,400 cases. It all depends. It all depends on the level of adherence. So we cannot say by this day this will be the exact number. It all depends on our behavior. So we have, all of us as Sri Lankans, we have a huge social responsibility, especially during this New Year period. That's very, very special because now we are having a good control, almost ideal control.
Right.
We should go down within next 2 to 3 weeks into maybe very minimal numbers. Then slowly we can observe maybe again about 2 weeks and start gradual relaxation. That has to go according to statistical and epidemiological principles, of course. I mean, it's going to detail.
It's not a political decision.
Not a political decision, but I think the political willingness plays a big role. And I'm sure government is very much willing to listen to the experts and then work accordingly. That's what they are doing at the moment as well.
Dr. Ajanta, there is concern regarding children always, especially during the breakout of this kind of a pandemic. How susceptible are children to this virus? Do they have any special risks involved?
Basically, if you look at the numbers around the world, it has been God's grace that the children have been less affected than the adults.
Right.
Because adults have other comorbid issues like cardiovascular illnesses, respiratory illnesses, diabetes, hypertension, things like that, which have made them get worse.
Right.
But you have to accept the fact that as human beings, like in the animal kingdom, we always protect our children. We don't take the children out unless absolutely essential. So with the curfew online, I myself being a pediatrician, we don't see even half a dozen children come into hospital for a day.
Right.
So unless it's absolutely essential, they don't come. So where have all these infections gone, the other infections? Probably parents, because the children are inside the house, they don't get cross-infected with viral infections. They eat good food at home, they don't pick and eat from outside, so they don't get diarrheal illnesses. So the two common things, respiratory tract infections and the diarrheal illnesses, are controlled.
Right.
So we don't see many children outside. So keeping the children at home and keeping them happy is the parents' concern. So I always advise parents, forget the TV if possible, most of the time.
Forget social media.
Social media for some time at least, and have a 1:1 interaction with your children. You will never have this option ever in your life again.
Exactly.
You follow? So this is like God's send. We have had a virus which is troubling us. We have put the parents to be with their children at home, and parents and children have 1:1 interaction where their development, their integrity, the children's IQ will be much better, and they won't have other vivid illnesses like this. So it is a blessing in disguise to some extent, but we also have to look at their schooling. So maybe today's media, the social media and the digital world has helped us to develop online courses and teaching online for children. which has helped parents to keep some work going on with their children. So overall children are fine, touch gold. So, and they are fine at home. Very few children have got infected because of parents. But as I told you, the parents always tend to look after their children. Unless it's absolutely essential, they are not they make sure that they are not involved in it.
Dr. Ajanta, another point that a lot of us seem to miss during this whole outbreak is the fact that there are many patients in Sri Lanka who have recovered from the COVID-19 infection, and this is all thanks to the authorities that are involved in controlling the spread of this outbreak. There are more than 50 patients who are currently recovered. So the number of people who are currently receiving treatment are a little bit less than 150 patients.
That's right. So you're right on those numbers. People who have been considered to be recovered are people whose swabs have become negative. 2 successive swabs have been negative for the virus.
Okay.
The viral shedding has stopped.
Okay.
But it's very important to make sure that for the future, as Indika was saying, if we start looking at close contacts and who are asymptomatic, and if we really screen them and if we have the facility to screen them and look at the carriers, then we will have a better understanding of how good our control has been and how good our control has to be for the future to make sure that this is controlled well.
Right.
Very important. But also at the same time, as Indika said, if you give us according to statistics, if you get a 7-week lockdown with good control, invariably you should be able to get out of this.
Right.
God's grace, God's willing. But for that, we also may have to look at testing asymptomatic individuals who may be carriers to make sure they are not carrying the virus or not. It can spring up.
So
it's very
testing.
infective. It's very infective.
Right.
That's the concern.
Right.
You follow?
Also, Professor Indika, another question that that seems to come up over and over again is the fact that these patients who have recovered from the infection, is there a risk that they could be infected with the virus again?
Again, nobody knows. The worldwide data, sometimes there are some reports especially come from Korea and maybe Japan. There was few reports where the recovered patients have reinfected. So again, we really don't know. Maybe the virus is remaining dormant in their bodies and coming up like some virus diseases. Or maybe the immunity doesn't last long and there is reinfection. We don't know. The current hypothesis of thinking is in some patients it may be remaining in their bodies for the time period that is longer than that is expected. Generally, the time period is after symptoms are over. What is believed is after symptoms are over, and once the PCR test is tested negative, for about 2 weeks, the virus can remain in the body, and still you can spread the disease. Not in a larger scale, but it's possible. So that's the current thinking. But sometimes it may be possible that the virus lingers on the body longer than 2 weeks. So nobody really knows. So those may be the reasons.
So, Professor, when these patients are released from hospital, they're obviously kept for 2 weeks longer.
2 weeks longer, because believed that still they can shed the virus from their bodies.
Right. Dr. Ajanta, when we look at the global scenario of the COVID-19 pandemic, the situation in other countries is not as good as it is here in Sri Lanka. Take, for example, the United States. They are suffering with a lack of ventilators, a lack of testing kits, a lack of medical protection as far as gloves, face masks go. Does Sri Lanka have any such shortage in ventilators or any of the other equipment that are required?
I think this has been discussed before also at a higher level. One important factor that we have so much of good control and keeping the cases down is to prevent us going to that stage. Right. I think we are working well so that we have very few cases who are really getting bad and who need ventilators.
Right.
If I look at the total number of basically, what do I call it, the amount of ventilators available in the Sri Lankan setting in the government and the private sector, there are about 500 if I am not mistaken, and the numbers. But you must realize the fact that there are other sick patients who may need ventilation for other illnesses.
Right.
So we cannot allow it to have a flare
Spiral
up
out of
control and then look for ventilators. So we, as I told you, we have one of the best public health systems, preventive health systems in the country, in the world, and we have to make sure that we don't allow this to spread. Very important factor is that. What you have to realize is, we may not get 100% control, but we can keep it at a lower level till people who get infected and it settles down. But if we allow it to rupture out like what has happened in the US, you won't have any control. You will be stuck for basic requirements, consumables and all that. So it's not worth ourselves looking at allowing it to spread out and then see whether we have enough ventilators, whether we have enough PPE equipment, whether we have enough ambulances to transport them. I think that is a secondary matter.
Right.
The primary matter is to keep this under control. Very important. I think that is the most important factor, which has been done very well with the government.
Also, Professor, speaking about the New Year season, it's a season of giving, a season of spreading love. A little bit out of your profession, but of course in the general context of humanity, how important it is that communities really come together, not in the literal sense of the word because of the social distancing principles, but face this pandemic together as one country instead of, turning this into a whole racial and bringing in this in a different context to face the real enemy, which is the COVID-19 pandemic. How important do you think it is?
Very important. I think that's the key, because this is essentially a social responsibility, a community responsibility. That's why this New Year period becomes a period of hope and courage, and to celebrate the courage of the people, of the citizens, and also to have hopes of new era, where the country will come out of this situation facing successfully, and to celebrate the humanity. Like, that's the most important. Celebrate the humanity. Social distancing or whatever physical distancing doesn't mean emotional distancing.
Right.
You have to connect.
There's a big difference between the two.
There's a huge difference between physical distancing and emotional distancing. And health is not only physical, it's psychosocial as well. So make use of this New Year period. In a way, this can be a blessing in disguise also, because this New Year period, this feeling of the celebration would give us a break from the very gloomy feelings that we are having, because psychological health is also very important. So think of humanity, connect up and enjoy.
Dr. Ajanta, we're nearing the final few minutes of the show, but I'd like to direct one question to you now. The people who have been most infected by the COVID-19 pandemic across the world, but especially speaking about the Sri Lankan context here in Sri Lanka, are the people in the poorest sector of the country, the people who work on a daily basis, who engage in manual labor to earn a living. These people are left completely helpless, completely destitute, and they don't know how to make ends meet. Now, while the government come forth and they have implemented certain measures, there is a small lack as to the distribution of these monies among the people and these measures. Some people are still there without food and without proper facilities. What is the message that you have to these people when it comes to their suffering and how they can contribute to controlling the spread of the COVID-19 pandemic?
I think it is very important for people to realize, which has been told over and over again, that to hold tight, manage with minimum possible, and keep control so that this infection gets under control. That's the most important factor. Okay. There were a few interviews which I watched on TV, where one of the Buddhist priests mentioned, even if you have rice and salt for the next 2-3 days, eat that and be at home. Go in search of food where you will get infected and you will succumb to it, and your family will suffer because of that. You follow? So, but on the other hand, we should say the Triforces, because on a previous interview I had with through Minnal, we had mentioned this. The Triforces doctor who was with us at the interview board, they have looked at distributing packs of worth for 1,000 rupees or 500 rupees, which they can afford to be given to people where they are unable to go and purchase stuff. Right. But if you really look back, if you speak to the Grama Sevaka Niladaris in the various sections, again, like the public health midwife, they know every single house who is living, who is having a problem, who has no job and all that. The lorries have been utilized by them to go and distribute to these places. You follow? But you must also realize that the people who cannot afford may not be able to buy stuff for 1 month. So they need a supply every 3 to 5 days, which I think the government has really looked at it and they are supplying. Because if you look back, we have gone through 3 to 4 weeks, touch gold, very few people are grumbling. Okay, so you have to accept the fact with all these difficulties, our main motive is to win this battle, be confident, be courageous and be healthy and prevent, we have to all get together to prevent this coronavirus troubling us. So we have to get control, very important.
Thank you very much, Dr. Ajanta, former president of the Sri Lanka Medical Association, and Professor Indika, the current president of the Sri Lanka Medical Association, for joining us on our show this morning, and especially for those encouraging words in this time of crisis on how to celebrate this festive season amid the coronavirus outbreak here in Sri Lanka. Thank you very much to all our viewers out there for tuning in to Newsline. We will meet you again, same time, same place, tomorrow. Until then, take care, stay at home, stay safe. God bless.
News First, Newsline.